Hi, my name is Debbie Komisak. I am recording this video presentation of Organizational and System Leadership, the Final Change Project. I have chosen the topic of falls reduction in the pediatric unit where I work. Falls seems to be an ongoing problem within the unit. We had 3 falls, 2 with injury in the past month, and I want to change the way we identify fall risk patients and how we implement the tasks we utilize to reduce the falls that we encounter. We also had a fall with a parent holding a child that was a patient, and they both fell. So this is a potentially big problem within our unit. Children are at high risk for falls. Some people think it's normal for children to fall. Their age, their developmental abilities, and their lack of knowing their limitations can all contribute to them falling. Also, some risk factors are just being in an unfamiliar setting, such as a hospital using narcotic analgesics on some of the patients, and also I found that having ill-fitted clothing such as gowns being too long and tripping, or for instance we have a footwear that is rubber gripped, but they only come in small, medium, and large, and a lot of them don't fit our children's feet, and they end up being too big, and they have been tripping over them also. So I feel like Falls Change Project would be good. It's my rationale for wanting to do this project. The Joint Commission and Institute of Medicine concur that pediatric population falls are a detriment to the patient and the institution. They require that the hospital have an action plan to reduce the amount of falls that we have, and also a distinct factor to determine the impact of that action plan. The leaders or stakeholders in the project would be myself and 2 nurses, 1 from each shift. We do day shift and night shift, working 12 hours. I feel the input from the different times that the nurses work would help with coming up with ideas since they encounter the patients at different times of the day. We need to draw ideas from both of the shifts, and positive impacts for the stakeholders would be to decrease the number of falls we have for the patients. We could face some challenges with that also. The internal stakeholders would potentially not want to do any changes because people are inherently object to any kind of change, and the external stakeholders may be non-compliant with the rules that we set forth on the unit. I would use SMART goals for my change project. I would begin with having a falls committee be formed. We would have meetings once a week. I would designate the time and day of the meetings that would be beneficial for all of them, the people on the committee involved. I would read over the policies that we have and present them to the nurses on the committee, and we could go over it and see what's working and what's not working, what needs to be changed. From there, I would improve on the plan that we have implemented to reduce the falls, come up with more ideas and brainstorming. I would do that in 2 weeks, and going over those ideas and hopefully implement them, and as a goal have reduction in falls. In my change project, I looked over the theory of Lewin's change theory of on-freezing, movement, and refreezing, and I felt that that would be a good theory for this project. The movement the on-freezing would be to persuade the group that the change is coming about. The movement would be doing it quickly so the change could occur, and then the refreezing would be that it would become second nature to the people involved, and they would learn to do it and accept it. I would make an announcement for this change project with a memo to all of the staff, and then I would use a flyer placed at the nurses station and make it interesting and positive that they would want to join the committee and input their ideas for this project. Financial considerations would certainly be necessary. I would use a budget to come up with the ideas. Some of the benefits that would be included in my change project would be installing a better, softer flooring, using handrails, using proper size footwear. Hopefully the benefits would increase admissions to our facility because of our safety record, that people would want to come and stay at our institution. I did, on my research, find interesting in the book that a budget, since I don't know much about finances and budgeting, that it could be used, you could make up a budget with using the nursing process of assessing, diagnosing, planning, and implementation, and using those ways to actually bring up a budget. It would be a operating budget. This type of budget, the cost of supplies and labor, for supplies and labor would be reflected, and the savings would be utilized for the project expansion, safety training. I would have a safety incentive program and public education. My timeline would hopefully be over 6 months. I would say that the change that I implemented would come out with a reduction of falls. I would need an assessment tool to base those findings and analyze my findings that my change project actually was a benefit. I would make this assessment tool with a checkoff box with statements such as the age of the patient, family members with the patient. They would need documentation that the falls prevention was noted on admission, the teaching, proper size footwear was being used, if the patient received any narcotics, was the call bell in reach, and was the walkway cleared of any equipment and cords. Based on these answers to the questions, and if the individual child fell or not, I would analyze that data and conclude if my change project was beneficial. Having this assessment tool is necessary to keep up with accurate records and measurements. And the nurses need to use this assessment tool as part of their daily tasks. If the tool is to be effective, it must be used every shift. I learned a lot doing this assignment, with researching everything that's involved in a change project, and was a little surprised about all the work that is needed in a managerial level to come up with policies or changes such as this. Thank you.